So this will be interesting. I'm going to talk some facts, and then I'm just going to talk some ramblings of an old ER doc on things that I think they should want. So we'll jump into this and see how it goes here. So who are our new graduates, emergency medicine graduates? Well, it's very interesting right now because they went to medical school during COVID, and they couldn't really go to class for at least 3 of those years. Even their clinical time was not spent with patients to a great extent, as great an extent certainly as generations before and even now. But this is a unique sort of class. For the next couple of years they went through during COVID, and they had to do a lot of their training by Zoom. So it's very interesting. They are very technologically savvy. These are when they were kids, they were on, their computers doing computer games. They're extremely computer savvy and technology savvy. And then there's the things that happened that Sherry just sort of mentioned. We had the ED workforce study that said, we're going to have, too many residents, there's not going to be enough positions. That came out in 2020. And then, as Sherry mentioned, our matches went down, the EM match. 3 years ago, we didn't match 170. The next year was we didn't match 417. You got to remember, for the 30 years prior to that, we had between 3 and 7 open spots every year. So then we went to 117. People got worried. Then we went to 177. We went to 417. A year ago, we were at 555. And we started to panic a little bit. Like, what is our new workforce going to look like? Are we going to have to get more foreign medical grads? Are we going to have to get doctors or residents that wanted to go into another specialty but couldn't? And this has happened several times over the last 30 years. It happened in anesthesiology in the 80s when they thought CRNAs were going to come. The number of open positions went down, and now it went back up. Radiology did a similar thing. This year, we only had 132, and I say only when we were 3 to 7 for 30 years, but it looks like we've hit that nadir, and we're starting to come back out like all the other specialties have. Some of the workforce implications have not come true. There are plenty of jobs out there, and then but the workforce has changed, and that's the new workforce that's coming in has changed, and I want to talk a little bit about that. There's also the fact that EM is the #1 burnout for specialty for 2 years, at least 2 years in a row. I know you might not be able to see that, but emergency medicine's up at the top of most burned out. All right, and the average medical school debt is $250,000. We have a lot of our residents are well over 300, but on average it's around $250,000, $255,000. So they're starting out with that hole, and they need to, I'm going to talk about a couple things, but compensation is clearly important. Loan repayment needs to be as important. So it's a little different class than in past generations for all of these things that are coming out. And this will still probably be true for the next 4 or 5 years. So we have to think about that. But there is still the good life, right? I mean, we're not at the highest, but we're in the average in terms of average, median salary, which is about $354,000. And so they have that to look forward to. That's, pretty decent salary. We've always kind of been in the middle of all the specialties. And that is something that they all know and all recognize, and, are very savvy now about, what the compensation models and so forth are. So what do new graduates want? And this is from some of my interviews. This is from, the literature. What are the things that they want? And again, compensation, as every generation, that's important, all right? They want a competitive salary. They may not, you know, there is a sort of a sense of entitlement that when I come out, I should get the same as everybody else, and that is just true almost in every specialty. You know, especially in emergency medicine, because we are more of an hourly-based specialty. Some of them that are employed, you know, will get different compensation based on years of service and their role and so forth. But for the most part, emergency medicine is a hourly rate. They're employed, and they're looking at for a competitive salary. And they will know in the area what the salaries are. I mean, again, they're much more savvy than in past generations. They are looking, they all have about $250,000 in loans. So they need to be able to have a, you know, look at, especially if they have any sort of loan repayment possibility. And they are also much more savvy than we were in terms of retirement and saving for retirement. And that's a good message, okay? 38 years ago or 35 years ago when I graduated, it wasn't, you know, that wasn't one of the top things. It was nice. I did get some retirement, but I didn't really think about it as much. There's a lot more knowledge out there about this. They're being taught this in medical school or in residency, and maybe medical school, but that is something that they're looking at. So it's not just necessarily the salary. They're looking at other aspects of the compensation, and that's good. You know, much more, I think, than in previous generations. Employment. They actually want employment. Only 33% are in private practice, and that keeps going down every year. You know, there's a whole lot of you know, chatter right now about the large groups. And my honest opinion is it's pretty hard to be a single solo group now with the way you have to negotiate with insurance companies and hospitals. It's hard. Not that it's impossible, but it's hard. You know, we're also hearing a lot now about possible unionization. ACEP just did a survey on, you know, should we unionize? And it was over 60%, mainly the younger doctors that are thinking this is the solution to our problems, is to unionize. I think it's a very short-sighted, but they are thinking this way. This is the new generation that is coming out. And they're comfortable with employment, but they want due process. They want the ability to have more control of their environment that they may not feel in the current system they're getting. Again, I don't feel unionization is necessarily the way to go about that. Maybe we'll talk about that this afternoon in our Nick Drills and I work breakout session. But I think it's very interesting. They are thinking about that. Over 60% want unionization. They also want work-life balance. In fact, this was the #1 rated priority. And again, I don't think anybody's ever in work-life balance. I think, you know, you have to look at work-life integration. I'll have a slide later on that. But they want some flexibility in their schedule, all right? And again, don't kill the messenger. This is the double AMC below. 52 to 54% of medical schools now are females. And the double AMC study shows that up to 40% of female physicians go part-time or leave the specialty or medicine altogether within their first 6 years. And the reason being is they have, you know, if they start family, right now the way society is, females take on a lot more responsibility at home. And that's, you know, so when you're looking at hiring new graduates, you have to think about this. So benefits such as maternity and paternity leave are going to be very important. Looking at ways to bring those people back into the workplace eventually are going to be things you're going to have to think a lot more about. The other, the other thing that full-time hours, are you seeing people want to come out, they're hiring to work 144 hours like they used to for 20, 30 years? When I hired, 30 years ago, that's what a full-time was, 144. We're finding, within our group and company, which has, 4,000 doctors, is, they want to work about 120 as their full time. And that's going to have a lot of implications for your group because, with the things I just talked about, the full time, you're going to have to hire about 1.3 to 1.4 people, physicians or clinicians, for every FTE that you have. And maybe you're not there yet, but you're going to have to start thinking that way. Most of you looking for physicians or clinicians at your practice right now? Can I say nobody? We are. So it's something that I think we have to think about, new ways it's again a different workforce, and they have different priorities, and so we're going to have to start looking at that and changing the way either we recruit or our benefit packages and so forth, because that's going to be more important. I mean, I'm not saying salary's not, but there are other things that we really need to think about. They want a good clinical and practice culture, one that they can feel they can contribute to. They want to feel connected to the culture of your organization. They're often drawn to team-based models that align with their values. They want their work to matter. They want organizations that offer clear delivery mechanisms, give back to the community, versus just strictly profit-driven. They are, in some ways, more altruistic in terms of what they want their role in the community to be. And again, salary is important, but there's a lot of other things that they're looking for as we try to recruit. And again, technology matters. They want technology to work for them. They are much more technology savvy than we ever were, and they want technology that's going to work for them rather than them working for the technology. So the EHR, and I think we're going to see a lot more in terms of artificial intelligence dictating charts. They're very open to these things because they're comfortable with it, and I think that's something we have to think about. All right, did you know there's a book out there, How Not to Kill Your Patients, an ER Doctor's Guide to Life After Residency? Shahid Khan. Didn't know about this, but it's probably something I should read. Although I'm like 35 years out now, so. But, you'll open the door to care for many patients. You will serve as both a specialist and a generalist. You'll get comfortable with multiple interruptions per minute. You will make decisions based on limited information. You will need to ensure positive patient experiences. You'll learn to navigate murky legal waters, and you'll recognize the value of community participation. You're going to be working irregular shifts, irregular times, holidays, but when you have time off, you usually have time off, and unless you get into administration, then you almost never have any time off. And you'll learn to deal with death, and you will make a difference. It's an interesting book to read, and it may be something I'm going to give out to my graduates now, because it has some very interesting ideas. But and the title of it is very interesting. But I think it gives some very interesting observations as you go forward in your career. All right. So the first part was based on fact. Now these are kind of just the ramblings of an old ER doc. And I can't help it. I'm a baby boomer, so I'm going to talk about what they want, and then I'm going to tell you now what they should want. All right. And so by the end of the first or second year, I sit down with the residents. I go, when you are looking for a job, there's two things an employer wants. And I put this very simply, very crude but simply. How well you play in the sandbox and how fast you move the meat. All right? And those are the two basic things that our residents need to learn. They need to learn how to play within a team, how to deal with people, but we value in emergency medicine efficiency, all right? And so it's kind of crude, move the meat, but it gets the point across that they have to learn to be efficient, but not only efficient, but they've got to, demonstrate, good patient experience while doing that. And so I'm going to go through some of the tips that I think are important for a successful career in emergency medicine. Be honest and be a lifelong learner. You have to, to maintain your board certification now, you have to do all these LLSAs and other things, but you really should be a lifelong learner no matter where you go. It's certainly easy if you're at a residency program. It's much harder if you're out in the community, but you should become a lifelong learner. That will keep you engaged, keep you up to date, and frankly, make you a better physician. Do thoughtful charting. All right, so you should think, are you going to be comfortable if this note's read out loud in front of a group such as a medical review panel or jury? Does my note, especially your HPI and medical decision making, justify your final disposition, whether that's admission or discharge? And we spend a lot of time, you've had some documentation talk yesterday, but we spend a lot of time with our residents to go over these ideas. But it carries through in their career. It's easy sometimes when you're mad to write something down about the specialist or something. You don't want to be doing that. So listen to your patients. So now we teach them that they should sit down and spend the first 90 seconds, which seems like 9 hours, listening to the patient before they interrupt them. And that's a good habit to get into. Sometimes, when you're really rushed and you got all kinds of patients, it's hard to do. But you should be thinking you need to actively listen, as I talked yesterday, actively, meaning nodding, maybe clarifying things, summarizing things, but actively listen to your patients. And then keep your patients updated. Why is that so important? We struggle with this almost in every emergency department I go to. Patients' satisfaction, and satisfaction is correlated with their ability to stay in a coordinated care, whether they get better, consume fewer resources. There's all kinds of reasons why you want patients to be satisfied. But the longer they wait in your emergency department, the less satisfied they become. The way to overcome that is if you communicate with them more frequently, that even though they wait longer, that satisfaction doesn't drop as much if they feel they're communicated more. So, we're really teach our residents and for their career that they should be going in, somebody should be going in that room every 20 minutes, whether it's a nurse, a tech, or the doctor. They should be going in and informing those patients. That will help you, again, throughout your career and taking care of patients. And then talk to patients before they go home. Do not let the nurse discharge. You need to go and explain what's going on, why they're going home, answer any questions. Again, that's the moment of truth. They go home, again, for patient satisfaction, for making sure they follow their instructions, better care. It just makes sense. Communication, communication, communication. Treat your patients like they were your family members or your parents. Let the patients, know that you see them as a whole person, not just as a gallbladder or, the chest pain in room 6. It's even more important now as we, I don't know if your hospital, but my hospitals tell me I'm admitting too many people now. And so if we're going to be sending them home, we have to understand their social issues that may prevent them from getting care. So we have to take on more, especially now as there's a lot of pressure, with boarding, not admitting patients. We have to understand our patients better. And again, you remember that it's an honor and a privilege to practice medicine. It really is. Even today with all of our boarding things, we're still doing a lot of good out there, and you've got to remember that. Create positive, memorable moments. I think this is important because people don't always remember what you say. I mean, rarely do they remember everything that you say, even in your discharge instructions. But you know what? They're going to remember how you made them feel. So trying to make a connection with the patient when you come in. If they're military, I always ask about military. I do a lot of triage, and they got an interesting tattoo, I might bring that up. Or, women with some fancy nails, I bring that. I mean, it's just a way to make a connection with them to show that you care about them. Because they do. They remember how you made them feel, not necessarily what great treatment you gave or what you said. So I think that's really important. And get to know your colleagues. You want to have a career. It is not usually a lot of fun to keep moving around. I just asked my wife. I moved her every 7 years. And you need to get to know your colleagues and enjoy working with them and maybe even doing some things outside of work to get to know them better. It helps, extend your career at that facility. And then say yes to projects. You can be a trigger. That was part of my leadership role talk yesterday, is just getting involved sometimes. It doesn't necessarily mean you're going to want to be the medical director or the CMO, but every one of you should be a leader. And we should teach our residents that every one of them can be a leader. And so they should say yes to projects. They should want to improve their work environment. Am I missing? Oh. Take care of yourself. Aim for work-life integration. We talk about work-life balance. That's pretty hard, all right? You're never going to feel like you're in perfect balance. But if you can understand work-life integration, and when I'm working, when I'm not, you can understand, because work is a part of you. It is part of you. It's what you have become, a physician. But you still want to have those off times, and you've got, if you have family, you want to be part of family activities. So work-life balance is sometimes difficult, but understanding it's a work-life integration and how you can best manage that, probably the way to think about it. Don't be a complainer, all right? Play well in the sandbox. That's what I said. Especially when you first get there, you probably want to listen more, all right? You want to see how the system is operating. What are the political environment and issues with the hospital, within the group? Eventually, I think you want to say yes to projects and again, be a leader, be a part of the solution. But I think, initially, you have to come in with a positive attitude and really understand the environment better. Second to last here is pay yourself first, all right? So, don't go out and buy the Porsche with your first paycheck. All right, that's probably not a good thing. But what you really should do is sort of live like a resident for at least a couple of years and pay off your debt. All right, because you're already starting almost one home in the debt, one home in the debt already when you're starting from your medical school and student loans. So you should really look about trying to pay off your loans. I know for younger people, it's getting harder and harder to buy real estate now. Just is. The real estate market's way up. It's expensive money. So they should look at paying off their loans first. And then they'll have that ability to do other things. They really should maximize their 401k and other retirement options. I mean, we do a personal finance course for our residents. And talk about the one resident who from 30 to 35 puts in $5,000 a year and then stops, versus the one at age 35 that puts in $5,000 the rest of the time. The one who has more money, just barely, is the one who started earlier at the same interest rate. So starting early, trying not to pull that money out, but living like a resident a little bit in that first few years to help pay off your loans are important. Pay yourself first. I often tell them, set up a money market where every month $300 of your paycheck goes into that. Well, that could be a rainy day fund. So we look at things like that. And last, have fun. Don't take yourself serious. I mean, we're in a serious business, no doubt about it. But you've got to enjoy where you work. You've got to enjoy working with the nurses, all the other people, and so have fun with that. It will make you more well-liked, and you'll actually like working where you are better. So there's a lot of positives to that. So I talked about this yesterday, Compassionomics. Steve Tresiak and Anthony Mazzarelli wrote this book. I would highly recommend this, and their other book is The Best Medicine. And it really talks about compassion, giving compassion, because it's a branch of knowledge and scientific study, the effect of compassion on healthcare. And compassion improves patient outcomes, it lowers healthcare costs, and it improves burnout. Okay, you're finding meaning in your work, and you're showing compassion with people, and that again, how you made them feel, they will remember that, and you feel better about yourself. And sometimes it's hard on all of our patients to show compassion, but there are patients every shift. And now every end of every shift, I ask a resident, did you have tell me about a patient where you had a really good experience. Did you show compassion? How did that make you feel? How did it make the patient feel? That's what I'm focusing on now, because we're dealing with a lot of boarding, and it's not fun. Okay, emergency medicine is not so much fun right now with the boarding, patients, all the expectations. So I'm taking them out of that and showing, tell me about a good patient experience you had today. And I want them to focus on that, because I think that will help their career. So the Dalai Lama begins each day the same way. As soon as I wake up, I remember Buddha's teaching, the importance of kindness and compassion, wishing something good for others, or at least to reduce their suffering. Then I remember that everything is interrelated, the teaching of independence. So when I set my intention for the day, that this day should be meaningful. Meaningful means, if possible, serve and help others. If not possible, then at least not to harm others. That's a meaningful day. Begin each day with compassion in mind. And one last thing is, consider volunteering, being part of the community. At a lot of the residencies I've been at, we made them do a community service activity in the community. Because it's a way you can actively show compassion to others. Volunteering implies hope and is a way to reach out and use your skills to improve the lives of others. Research suggests that compassion helping triggered by volunteering improves stress regulation and immune function, cognitive functioning, health, and well-being. So, again, some of these were the ramblings of an old ER doc, but I think, the residents that are coming into the workforce now are different. They just are. They have some different priorities. They've got a lot of other things going on. They don't want to work as many hours as we did. And so I think we're going to have to look at ways that we can fit into this, but still allow them to have a very meaningful and fulfilling career. So thank you.